Welcome to Easy Anatomy. I'm going to talk to you today about the anatomy of spinal cord, and we touch base some of, ascending and descending pathways, not in detail, but just general outlines. So the spinal cord extend through the cervical segment of the vertebral canal down to the level of the intervertebral disc between lumbar 1 and lumbar 2. So here is the spinal cord which end at the level of lumbar 1, lumbar 2. So this means that the spinal cord is shorter than the vertebral canal. And actually, if you look at the spinal cord segments, which made of 8 cervical segments and leads to 8 cervical nerves. You have 12 thoracic segments, leads to 12 thoracic nerves. Then 5 lumbar segments leads to 5 lumbar nerves. 5 sacral leads to 5 sacral nerves, and 2 to 3 coccygeal segment leads to coccygeal nerves. Okay? If you compare that to the vertebral column, you will see that the vertebral column has only 7 vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and about 3 to 5 coccygeal. So basically, you will see that cervical nerves about 1 or 2 less than the number of vertebrae. So this is the extension of the spinal cord through vertebral canal, and as I mentioned, we have in cervical segment we have from C1 down to C8. Then you have T1 down to T12. Then you have lumbar 1 down to lumbar 5. Then sacral, then coccygeal. Okay, you have 5 sacral and 2 to 3 coccygeal. You will see that the spinal nerve coming from cervical segments usually exit above the corresponding vertebra. Like C1, you will see it exit above vertebra number 1. So this is vertebra number 1, C1. So the C1 nerve exit above vertebra number 1. And however, in thoracic segments, you will see that the thoracic nerve exit below the corresponding vertebra. So if this is T1 nerve exiting from the segment T1, here is thoracic vertebra number 1. The same for lumbar, the same for sacral and the coccygeal. Okay, and the reason for that, as you see, because we have 8 cervical nerves and only 7 cervical vertebrae. Okay, so the lower lumbosacral nerves, actually they come together and they form what we call it cauda equina. Cauda equina. So the cauda equina, this is lumbosacral nerves exiting the spinal cord, and they have to continue down through the vertebral canal to exit through corresponding intervertebral foramen. Okay, through the intervertebral foramen. So this is the cauda equina. So cauda equina. So keep in mind that cauda equina, this is representing the lower lumbar plus sacral and the coccygeal nerves, and they descend below the spinal cord through the vertebral canal. Okay, so this is general idea about the spinal cord. So the spinal cord again is shorter than the vertebral canal, and it ends up at the level between lumbar 1 and lumbar 2. How about the meningeal covering of the spinal cord? Keep in mind that the spinal cord is protected by 3 things. First, vertebral column. Second, meningeal covering. Third, cerebrospinal fluid. They protect spinal cord. And the spinal cord maintained in its position is not freely moving through the vertebral canal, but it is fixed by ligaments coming from the meningeal covering. We're gonna talk about it now. So here is the spinal cord again. And this is the level of lumbar 1, lumbar 2. Okay. And the first layer, meningeal layer around the spinal cord, is called pia mater. And pia mater attached to the spinal cord and end at the same level between lumbar 1 and lumbar 2. However, it continues down as a ligament. This ligament is called filum terminale. Okay. Then the second layer is called arachnoid, similar to the brain, and the arachnoid matter continue down up to the level of sacral 2. So this is at the level of sacral 2. Okay. So this is the arachnoid layer. Then the third layer is called dura, the dura mater, and as you see, the dura mater the same as arachnoid mater and continue up to sacral 2. So this is the arachnoid, this is the dura, this is arachnoid, and you have the pia mater. Okay, what is between pia and arachnoid? You have a fluid. What is the name of this fluid? This fluid is what? Is cerebrospinal fluid. So here is a cerebrospinal fluid running between arachnoid and pia in the subarachnoid space. CSF in subarachnoid space. Okay. Okay. So what else you can see in this space? This is subarachnoid space. You will see the cauda equina, the lumbar, sacral, and the coccygeal nerves. Okay, their roots are located or traveling through this space until they penetrate the dura and they come out through the intervertebral foramina. So this is the cauda equina. So if I ask you what are the content of subarachnoid space in the lower vertebral canal, you can tell three things here. You can see them clearly: filum terminale, you have cauda equina, and you have the CSF. And this area, which we call it lumbar cistern, and the word cistern refer to deep subarachnoid space or big subarachnoid space. You will see in the cranial cavity we have several cistern where you can see the subarachnoid space become bigger in certain area. And here is called the lumbar cistern. The lumbar cistern, this is the lower part of the subarachnoid space around spinal cord, and contains filum terminale, contain arachnoid mater and cerebrospinal fluid. What is the significance of that? First of all, is good place to inject anesthesia. So this is for epidural anesthesia, especially people with surgery in the lower half of the body, like cesarean section or lower part of the trunk, etc. They can receive anesthesia by injecting the anesthesia here in this area. Okay, it's safe because you don't go to the spinal cord. You are not going to hit spinal cord, however, only in the subarachnoid space. Second, it can be placed to injection of therapy, like chemotherapy, for example. So again, it is good place to inject some medication, for example, chemotherapy, and also injection of anesthesia. and also withdrawal or taking CSF sample or lumbar, we call it lumbar puncture. Lumbar puncture. And can be either for diagnostic or therapeutic purpose, lumbar puncture. So again, this place which you called lumbar cistern, it is the lower part of the subarachnoid space in the lower part of the vertebral canal containing filum terminale, which is pia mater, and cauda equina, which are roots of lumbosacral nerves and also cerebrospinal fluid. It is good place to take sample from CSF for diagnostic and also therapeutic. Lumbar puncture also can relieve the pressure, intracranial tension, if you aspirate some of the CSF. You can inject medication and also anesthesia. Okay. As I told you, the function of dura or meningeal covering extend to support the position of spinal cord. This is a spinal cord. How you support the position of the spinal cord? The spinal cord is not floating through the vertebral canal. Okay, it is fixed down here to prevent horizontal displacement by filum terminale. Filum terminale extend to the coccyx, attached to the bone, attached to the coccygeal segment or coccyx. Okay, and from the side you have extension from the arachnoid mater. Arachnoid mater triangular ligaments extend here and penetrate the arachnoid, coming from the arachnoid and go to the dura and fix the spinal cord, preventing it is displacement, especially longitudinal displacement. So this we call it, is coming from arachnoid, here. It's supposed to be this color. So this ligament, we call them denticulate ligament because they look like teeth. So denticulate ligaments, triangular ligaments extend from arachnoid and fix the spinal cord to the vertebrae. Okay, so you have two ways to support the position of spinal cord. First through this filum terminale, and second through denticulate ligament. Okay, so this is general idea about spinal cord. Let us go to cross section of the spinal cord. You need to cut the spinal cord in a cross section to understand the structure of the spinal cord. So spinal cord, if you look, it is made of white matter, and inside here you have H-shaped gray matter, Okay, there is a central canal inside where the CSF is circulating. So white matter, which nerve fibers. Then you have gray matter, which nerve cells. Okay, this is the anterior. The gray matter has anterior horn, we call it anterior horn, and this is lateral horn, and then you have posterior horn. Okay, the white matter, you have posterior column, anterior column, okay, and lateral column. So this is the general structure of the spinal cord in cross section. You have H-shaped gray matter, posterior horn, anterior horn, lateral horn, and dividing the white matter around it into posterior column, anterior column, and lateral column. As you see, there is connection between right and left white matter, right and left half, through what we call it anterior commissure or ventral commissure. Anterior, if you remember, commissural fibers mean connection between right and left side. Okay, fibers connecting right and left side of CNS. So this is anterior commissure. Then you have again the central part here of the gray matter, we call it gray commissure. Gray commissure, the central part here, surrounding the central canal. So this is a general feature of cross-section of spinal cord. Okay, what you see through the spinal cord, why you are caring about the cross-section of the spinal cord? Let us look at the cross-section of spinal cord one more time closely and understand why we care about that. So again, okay. So this is the spinal cord in cross section. The anterior fissure usually is deeper than the posterior one, as you see. The posterior horn give origin to the dorsal root of the spinal nerve. Dorsal root of spinal nerve, where you can see dorsal root ganglion. So this is dorsal root ganglion, and this is dorsal root. The anterior horn give origin to the ventral root of spinal nerve. This is the ventral root of spinal nerve. Okay? Both of them join each other to form what we call it trunk of spinal nerve. Now we have the trunk of spinal nerve. So this is the trunk of spinal nerve. So you have dorsal root, ventral root, trunk. Then the trunk of spinal nerve soon is going to divide into become here mixed, because the dorsal root is sensory, ventral root is motor. So the trunk become what? Mixed, has motor and nerve fiber. Then divide into ventral ramus, which also is mixed, has sensory and motor fibers, and dorsal ramus, which also is a mixed, has sensory and motor fibers. Okay, so you have ventral ramus and dorsal ramus. Okay, so we have dorsal root of spinal nerve, ventral root of spinal nerve. This is sensory, this is motor. They form a trunk where it is located in the intervertebral foramen, then divide into the dorsal branch and the ventral branch. From here to here, those are mixed. It has sensory and motor component. Okay. The sensory usually we call it afferent, because it carry information from periphery to the central nervous system, and the ventral root usually is efferent, because it carry information from CNS down to the periphery, to the muscle. Okay, so this is a typical spinal nerve. The origin of this roots usually connected to nerve cells. Nerve cells. This is what we call it here, anterior horn cells, anterior horn cell. And here we have group of nuclei nucleus particularly related to pain, temperature, touch, etc. So we have group of nuclei here. The top one we call it posterior-margin nucleus, and the bottom one we call it Clart nucleus. Okay, going through substantia, gelatinosa of Roland. So posterior-marginal nucleus. So you will see here group of nuclei posterior-marginal, substantia gelatinosa of Roland, then nucleus proprius, Clark nucleus. So you have several nuclei arranged from the top to the bottom, and here again posterior-marginal nucleus, the second one substantia gelatinosa of Roland, and the bottom here you have Clark nucleus. Okay, and keep in mind they are not located in all segments of spinal cord. They vary. Then anterior horny cells, which is a source of ventral root and motor root, they are arranged into medial group, lateral group, and intermediate group. The medial group, this is going mainly to the trunk and phrenic nerve. The lateral group mainly to extremities. Okay. The intermediate is not known for sure, but the overall, you will see the overall impression here that the anterior horny cells, they are arranged in three areas: medial, intermediate, and the lateral. The lateral going to extremities, the medial going to the trunk and phrenic nerve. Okay, so this is general feature of gray matter. So keep in mind again, we're still missing the important thing here. What is that? This is the lateral horny cells. Lateral horny cells. Lateral horny cells. Lateral horn cells. These are located in thoracic 1 to lumbar 1 or 2 segment, and sacral 2 to sacral 4. So thoracic 1 to lumbar 1, this is the origin of preganglionic sympathetic fibers. Sacral region, this is the origin of what? Again, preganglionic parasympathetic. Okay, how the exit spinal cord? Again, you have the lateral horn. This is autonomic, related to autonomic nervous system. In the thoracic region, mainly sympathetic. Sacral region, they give parasympathetic. How they exit this gray matter or spinal cord? Usually, they come out and join the ventral root. They come out and they join the ventral root. Okay, keep in mind that they join the ventral root. So the ventral root receives sympathetic or parasympathetic depend on the area, and they distribute to the blood vessels of muscles and also sweat glands, etc. So keep in mind that again lateral horn cells related to what? To autonomic nervous system. Okay, we're done with the gray matter. Let us go to the white matter. Again, let us have the cross section. This is the white matter. Then inside here we have the gray matter, central canal, anterior horn, lateral horn, dorsal horn. So what is this area? This area called of the white matter called what? Lateral column. And this one is dorsal or posterior column, and this is the anterior column. Okay, good. What is here? Tracts. So these columns contain ascending and descending tracts. What are tracts? Ascending and descending. Those are nerve fibers. Tracts, nerve fibers, carrying information either from periphery to central nervous system. What kind of information? Sensation. Descending tract, carrying information from CNS to the muscle. What kind of information? Motor information. Okay, so those are the tracts you will see here, either coming from periphery and go up, or coming from the CNS or from brain down to the muscles. These are ascending and descending tracts. Ascending and descending tracts. Okay, what are tracts here? Let us take this side for motor and this side for sensory. Here is the motor tract here. The most important tract here, which is motor tract, is called lateral cortico-spinal tract. Okay, there is another tract is called rubrospinal from red nucleus. Rubro referring to red nucleus, from red nucleus, located in midbrain. At the anterior column, you have ventral corticospinal and smaller tracts from tectum or vestibular nuclei or reticular information. Those are tecto or vestibulo or reticulospinal tracts. Okay, so this is what we call it ventral or anterior corticospinal. The cortico refer to cortex, cerebral cortex, spine to spinal cord. Then you have vestibulospinal from vestibular nuclei related to balance. You have tectospinal from the tectum, which related to vision also and hearing, but mainly vision here, related to visual response and to maintain also body balance. We're going to talk about this in detail later on. Then we have reticulospinal from reticular formation, reticulospinal. So those are the main motor tracts. Lateral side, the biggest one and the most important one, lateral corticospinal, pyramidal tract, rubrospinal. Then here, portion of the corticospinal descend in the anterior column. We call it ventral or anterior corticospinal. How about sensory? The sensory tracts, here you have in the posterior column two important tracts, cuneate and gracile. The lateral one is cuneate, the medial one is gracile tracts. So this is gracile tract, and you have cuneate. The function of those tracts, two tracts, proprioception, deep sensation, okay, touch, discriminative touch, vibration. We're going to talk about this in detail. Proprioception. So this is conscious level, coming from joints and peripheral tissue and ascend up to the cerebral cortex and responsible for deep sensation or sense of position, discriminative touch, and vibration sensation. the cuneate from lower half of the body, sorry, from upper half of the body, and the gracile from lower half. Okay? On the lateral side, you have major tract here for pain and the temperature. This tract is called spinothalamic tract, lateral spinothalamic tract, lateral spinothalamic tract. And this is for pain, temperature. Then anterior here is a ventral spinothalamic tract. Ventral spinothalamic tract. This is for light touch and the pressure, simple pressure sensation. Okay, but discriminative touch, gracile and equina. There are other tracts which are responsible for unconscious level of proprioception: dorsal spinocerebellar and anterior spinocerebellar. Anterior spinocerebellar, dorsal spinocerebellar, and those tracts for the unconscious level of proprioception. That's why they go to cerebellum, not cerebrum. Cerebellum, not cerebrum. Okay, and we will talk about this in detail later on. This is just the outline, general outline, and the introduction to the tracts. So you have descending tracts here, you have ascending tracts here. Okay, so this is representative of descending, and this is representative of ascending tracts. Okay, so from this we can divide sensation. What are sensation? We're going to talk about it. You have proprioception sensation, which is sense of position. If you ask your patient to close his eye, and then you start to move his limb around, he should be able to tell you if the limb is extended or flexed. So this is sense of position. Okay, and you have the conscious level, conscious sensation, carried over by gracile and the cuneate tract. The gracile from lower half of the body, cuneate from upper half of the body. This is the conscious. The unconscious level, this is go to cerebellum. You have dorsal and the ventral spinocerebellar tracts. This is for the sense of position. Okay, then you have other kind of sensation, which is touch, important, and touch can be divided into discriminative or vibration. For example, if you handle your patient a coin or a key while he or she closing the eye, they should be able to identify and tell you what you handled them, whether it's a key or coin or pen, etc. So this is this is what we call it tactile discrimination or discriminative touch, or 2-point discrimination also. Okay, if you touch your patient with two sharp things at the same time, they are like that, they should be able to tell you that they have been touched by these two things. Okay, so you need to be able to differentiate between proprioception and discriminative touch, and astereognosis, which able to astereognosis to identify what objects you handle your patient, or discriminative touch, 2-point discrimination, or sense of vibration, all this under touch. There is another touch sensation, and this is still carried by gracile and cuneate, but there is another touch which is simple pressure and this is biventral spinothalamic. Then you have pain, temperature, sensation, bilateral spinothalamic tract. Then there is a spino-visual sensation, and it is very important sensation. We will cover it again and talk about the connection between visual system and the spinal cord. Okay, so this is a general introduction to the sensation, and we will talk about them in detail later on. Before I end, I like to highlight the blood supply of spinal cord, because this is very important topic, blood supply of spinal cord. Blood supply of spinal cord, the main blood supply is coming from, here is the vertebral artery. You have two vertebral arteries, okay, one right, one left. They join each other, they form basilar artery, but these send one big artery is called anterior spinal. So this is vertebral on one side, vertebral on the other side, and here is the basilar. Okay, both of them, they participate in forming this big artery which we call anterior spinal artery. It is a single artery. Okay, then each one of them send another artery is called the posterior spinal. So this is posterior spinal and this is posterior spinal. What is the difference then? Okay, if you have cross section in the spinal cord, here is the gray matter again.